a month in the market?
Well, I've been doing rather well. I've been averaging about $3,000 a month. What I mainly do, Blake, is I trade futures, and if you do it by the OTA rules, there's a good chance that you can make money doing it that way.
For almost 2 decades, Online Trading Academy has taught over 200,000 students of all ages around the world the right way to trade stocks, options, futures, and Forex. Real classrooms, hands-on training by instructors who are certified, currently trade, and are profitable. Attend a free class at Online Trading Academy, South Florida. Seating is free but limited. Free half-day classes in Broward and Palm Beach. Call now for you and a guest. 561-674-9800. 561-674-9800. That's 561-674-9800.
Talk health. Talk wealth. Talk politics. Talk 1470. WNN.
From simple sprains to highly complex surgeries, the Orthopedic Center of Palm Beach County has been serving the South Florida community for over 65 years with the finest orthopedic and pediatric care. Our physicians are each experts in their field, providing a complete spectrum of musculoskeletal care from prevention and diagnosis to treatment and rehabilitation for every part of the body in both children and adults. Our doctors are able to perform the most advanced treatment options available, including PRP therapy, stem cell, arthroscopic surgery, and microsurgery. At the Orthopedic Center of Palm Beach County, we are dedicated to providing a comprehensive solution to get you back to your routine as quickly as possible, in the shortest period of time, with the least amount of inconvenience. With 3 beautiful new offices located in Lake Worth, Boynton Beach, and Wellington, we are able to provide much-needed care to families in the South Florida area. Give us a call at 561-967-6500. From our experienced physicians to the most advanced treatment options to our state-of-the-art facilities and excellent support staff, the Orthopedic Center of Palm Beach County is committed to providing you with the very best care. Call us at 561-967-6500 or find us at www.ocpbc.com.
My name is Trevor Matcham, administrator at Whitehall Boca Raton. Whitehall is a long-term care facility that specializes in short-term rehab. We provide physical therapy, occupational therapy, speech therapy. We've been in the community since the early 80s. We have a stellar therapy program. We have about 40 therapists on staff. We take care of people that might have knee surgery or hip surgery. For more information, you can give us a call at 561-392-3000 or visit us on the website at whitehallboca.com.
If you believe you can or you believe you can't, you're right. What do you believe? Who is the only person who can stop you? Only you. When was the last time you have someone holding your vision, your dreams for you? When was the last time someone held you accountable for achieving them? That's when Lorena Anderson steps in and becomes your coach, your personal energy coach. With her powerful and proven techniques, she will assist you in assessing and accelerating your maximum potential. One of the most powerful tools is quieting your mind and relaxing your body. It allows you to de-stress and calm and eventually brings your happy back. If finding your happy is important to you, please call the Energy Shifter, Lorena Anderson, at 954-647-5525 to schedule a free half-hour phone session, or email her at lorenaanderson@gmail.com. She's looking forward to connecting with you. Call her. The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hi, welcome to You and Your Doctors.
I'm Lorena Anderson, your life and energy coach, and also your host for this evening. And I'd like to welcome you to our show that airs every Tuesday evening between the hours of 6 and 7. You can follow us on 1470 AM, and we're also streaming live on allcountyhealthcare.com and also wwnnradio.com, where you can follow us no matter where you're at, whether you're on web TV or if you're on the radio or in the car. This is an interactive show. So we would love if you would call in with any questions that you might have for our guest. The telephone number is 888-565-1470. So please give us a call. This is being presented by AMP2 TV and also proudly sponsored by All County Healthcare, where patients are the heart of their business. And that's really important because when you want to have somebody that's dependable and that cares, that has compassion and patience, it's really, really important to give All County Healthcare the call. And welcome to our Facebook friends, because we're streaming live on All County Healthcare. And if there is any question that you might have about All County Healthcare, please just give them a call, 888-717-7170. Ask for Maddie. She would love to answer any questions that you have concerning your healthcare needs. So without any further ado, I'd love to welcome our guests. Again, thank you, All County Healthcare, for bringing on these guests, because they are the individuals, the professionals, the experts in the industry that can help you make those choices that are so absolutely necessary for your healthcare. So I would like to introduce our first guest this evening. Hi, Dr. Charles Guabert. Did I?
You said it perfectly.
I did? Okay,
Yes.
okay. I've been practicing, can you tell? Welcome to the show. It is wonderful to have you here this evening. I know your schedule is incredibly busy, so I really do appreciate you taking this time and helping to inform and educate our audience. So please tell us your specialty.
My specialty is physical medicine and rehabilitation, also known as physiatry.
Physiatry. Well, that's a first one. I've not heard of that one before. That's very interesting. Tell us more about that.
Well, it sounds a lot like psychiatry, doesn't it?
Yeah, it does. Without the pills? Oh,
Well,
no, maybe with pills.
I think every doctor has a little psychiatrist in him.
Yes.
But the specialty is really all about helping people get better who have injuries or diseases affecting their musculoskeletal or neurological systems. Mm-hmm. And so it can be anything from simple sprains and strains to more complex things like brain injuries and strokes and spinal cord injuries. And so the specialty encompasses all of that.
Wow. Well, that really must keep you busy. It sounds like you have, there's many, many different facets to your particular specialty.
It never gets boring.
Yeah, I
Never
would
gets
think
boring.
so. So tell me, give us some of your background. Where did you go to school? Where did you grow up? And what made you decide to go into this particular expertise?
Well, I'm from South Florida, born and raised in Miami,
Oh my gosh, a native.
a native Floridian. Been through a few hurricanes myself.
Oh, yeah. Not that we're not looking at any hurricanes right at this very moment. Thank you, Matthew. Go ahead.
Went away to college and then came back to medical school at the University of Miami, and then did my residency training at Parkland Hospital, which is University of Texas Southwestern in Dallas.
Wow. Okay.
So I was there for 3 years and then decided to come back 22 years ago, back to South Florida, and moved to Palm Beach County and joined a practice and have been with that practice ever since.
Have you? Oh my goodness.
Yes.
So it says here on your card that, you've been in business for 65 years. I was looking at you and I said, no, you've got to be kidding me.
I started
we're
very
close.
young. Right.
Well, it sounds like this particular practice that you've been at. Well, first of all, where can they find you? I mean, where is it located? Your telephone number, email address, or your website?
Sure. So we have been in practice for 65 years as a practice. And of course, we've had several different groups of doctors that have come in over that time. So I started with the group 22 years ago, and now we have 14 physicians in the group, and we're a multi-specialty group. And I'm the sole physical medicine and rehab doctor in that group. And basically, I provide non-operative orthopedic care in the group.
Oh, okay.
So we have 3 locations. And I say that because our third location is we're going to be moving our third location very soon. So our main location is in Atlantis, right on the campus of JFK Medical Center.
Okay.
And we have another location in Boynton Beach, and that location will change within the next month. We're soon to move to a new office in that area.
Oh, wonderful.
Right, so
Good for you.
That's going to be off the Boynton Beach Boulevard, Eau Claire Ranch Road area.
Is that an expansion for you?
Well, we're in an office now, but we decided to build our own building.
Oh,
and
that's great.
Right, so we have our own building. We'll have our own surgery center in the building also because most of my partners perform orthopedic surgery. So that location will open November 1st. And then we have a third location that's going to be opening probably in February in the Wellington area off the 441 corridor near Wellington Regional Medical Center.
Oh, okay. Oh, that's wonderful. That's a beautiful area out there. Anyhow, well, congratulations.
Thank
That
you.
sounds wonderful. That's just great. And it sounds like, your practice is really bringing a necessary element to those areas. And what are some of the specific difficulties that your clients, your patients might come in with?
So for me, I do a lot of spinal work. And
Okay.
so most of my patients come in with a complaint of pain. They have neck pain, mid-back pain, lower back pain. And so what I do is take a history, do an examination, order whatever types of diagnostic studies I might need. Sometimes they need a battery of tests. Other times they come in with tests that have been done by other doctors. And then I come up with a diagnosis and then a treatment plan that is really tailored to their needs and helps them.
What do you see most of? What usually comes in? Is it lower back? Is it mid back? Is there any one of those areas that you see more of?
I would say primarily low back pain. It's not the only thing that I treat.
Right,
With our
right.
geriatric population, of course, I see more older patients than younger patients. And so a lot of them have degenerative diseases and problems, mostly related to the aging process. So you've got arthritic conditions that affect the spine. You also have conditions like diabetes and obesity that can really affect people's health. So I have an interest in that as well, and trying to help prevent injury and get people better by addressing those areas. But most of what I treat is low back pain, and that can be brought on by a multitude of injuries, causes, and so we try to properly diagnose the patient and then tailor make a treatment plan, for them specifically.
Excellent. So I know I asked this about to you before, but what made you decide to go into this? What ignited that passion within you to go into this specialty?
Well, I knew I always wanted to be a doctor from a young age, and I really wasn't sure what I wanted to do. I always gravitated towards orthopedics, and I thought I might want to do surgery and work with tools and construct and fix and do things of that nature. But then as I got into medical school and I started learning a little bit more about some other areas in medicine and the rehabilitation side of things, I thought that I could do a very similar type of medicine, but focus more on the rehabilitation aspects of that in a non-surgical way. So I hadn't been exposed a lot to my specialty because 25 years ago, there weren't a lot of doctors doing what I do, especially in the state of Florida. We didn't even have a training program in the state of Florida.
Really? Wow.
So I spoke to one of my med school classmates who was a few years ahead and had graduated and gone into this field. And he kind of steered me in that direction. And then, that's the direction I decided to go. Got accepted into a residency program, and here I am now 22 years later.
Wow. Well, it sounds as if, just the right doors had opened for you at the right time, because you're right. 25 years ago, they didn't have your specific specialty. They were still busy going in there and doing surgery and everything.
Well, it's interesting. The specialty actually was started in the mid 1940s. But a lot of people didn't know about the specialty because it was closely tied into physical therapy. So they thought a lot of the doctors were physical therapists.
Okay.
But they were actually medical doctors. And after the polio epidemic hit, there was a lot of patients that needed to be rehabbed in this country. And so the specialty became much more widely accepted. And then there were a lot of veterans coming back with injuries from World War II and the Korean War. And that sort of launched the specialty of physical medicine and rehabilitation.
Wow. Well, that's really interesting. Thank you for that. Well, you do something really that's quite different as well. And we're going to talk about that in a second. But at this moment, I just want to say thank you, All County Healthcare, for providing this show, you and your doctor, living a longer and healthier life. Thank you so very much for putting this show together so that we can, first of all, showcase some of the doctors that are available out there for you, but also to allow you to become educated and know where you might need to go in order to get the proper health care that you so necessarily need. So I want to thank you again for being on the show. But I want to go back because there was something very interesting that I learned about you, and that is that you do acupuncture. And you don't very seldom hear that a medical doctor, an MD, ends up doing acupuncture. Tell us a little bit about that.
Yeah, so 10 years into my career, I was becoming a little burnt out with treating people for pain and being frustrated that I didn't think I could help them the way I wanted to. And I had certain subsets of patients that would come in that maybe were searching for certain types of narcotic medications. And I felt sort of stuck and wanted to be really careful about how I practiced, keeping myself and the patient out of trouble. And one of my partners, just on a whim, suggested, why don't you look into acupuncture? And so I found that there was a course at the University of Miami, and that's where I went to medical school.
Okay.
So I looked into the course. There was only a few courses in the country that did
I was going to say, yeah, that's so unusual.
Right. So there was one at University of Miami, which was close enough. There was another one in California, and that required a lot of travel and taking me away from the practice. So I decided to go back to my alma mater, and I decided to do this class, a course. It was a full 6-month course, and it was done practically every Saturday for 9 hours for 6 months.
Wow.
And it was taught to medical and allied related fields, not necessarily all doctors, but there were some chiropractors and there were some therapists there to really teach you how to do acupuncture. And so I took the course and right away just really fell in love with the concepts and the ideas because they complemented what I was doing so much. And so that was 12 years ago, and I've implemented it ever since into my practice. And it's just a part of my treatment protocol and my algorithm. So I have a lot of information out of my practice, and you would be surprised how many patients ask me about that.
Oh,
it's become
yeah.
a real standard part of what I do now.
I love that. That is so great because, I'm all for alternative medicine, but married with Western medicine as well. The two of them working together side by side instead of one opposing the other. And you are a prime example of how that marriage happens, because you've integrated both parts of that, the Eastern and the Western medicines together in order to help your patients. So I kudos to you. That's wonderful.
It's interesting because I practice a form of acupuncture called medical acupuncture. So a lot of the medical professionals in the country practice that. So in other words, they're still using their diagnostic tools that they learned in medical school, but they're applying the treatment protocols for the meridians and needling for acupuncture that correspond to the illnesses that they're diagnosing. And that's what I do. And I primarily focus on musculoskeletal problems because that's what I treat. So that's what I do. But I had to be convinced at first. So the whole idea behind the course.
Did you have to hurt your back or something before you could be convinced?
Well, I had to actually go to the course and make sure that it really was a legitimate modality because I had doubts the whole time. So anytime a patient came to me and asked about acupuncture, I would just roll my eyes back in my head, really, until I took the course and learned about it. And then I started doing it right away. And I understood that the acupuncture meridians anatomically followed a lot of the neural pathways that we have in the body.
Absolutely. Yes.
And then I practiced on my staff.
Oh, I was going to say you practiced on yourself. I was going to say, that would have been interesting.
And family members. But when you have physicians in your practice that have problems and they come to you and you help them with acupuncture and then they bring their family members to you. And now I've done acupuncture on many family members of physicians in the practice and I'm helping them. I've now convinced my partners that acupuncture is a legitimate modality to use. And so they refer patients to me.
I love that. That is great. That is great. Well, that really is, one of my questions that I love to ask is what makes you different? And I think that you've answered that fully, that, just integrating the acupuncture along with traditional medicine. And you're right, it does. It follows the meridians. And that's what you're working with, to get the blood flow going through on those meridians to encourage the growth of the healthy cells. So that's yes. Fabulous. Good for you. Good for you. So you said that you have 3 different facilities and that there are 14 doctors that are in your office. Are they all orthopedic surgeons? Or do they have their own little specialties? Like, one might work only on ankles and another one might work on shins or...
Sure.
Help us.
So I can break that down for you.
Okay, great.
So we have what we call a spine, sort of like a spine center in the group.
Uh-huh.
So I'm the physiatrist who does the non-operative care.
Okay.
And then we also have 2 anesthesiologists that are board certified in pain management that do more of an injection-based approach.
Oh, okay.
And
All
also
right.
do some medication prescription. And I, too, prescribe medications. And we all prescribe physical therapy. So we also have a full PT and OT center in both of our offices.
Oh, that's really good to know.
We do the full gamut of care.
Okay, great.
But we also have a fluoroscopy suite in the practice where the 2 pain management doctors do fluoroscopic guided injections. So things like facet injections and epidural steroid injections. And for people that have really chronic conditions that have failed those types of things, they even do pain pumps.
Wow.
So we have a group of doctors that do that.
Okay.
And then we have an orthopedic sports medicine doctor. And we have another doctor that specializes in hip and knee injuries and surgeries and non-operative care. And we have 3 doctors that do foot and ankle care, both operatively and non-operatively. We have 2 pediatric orthopedic specialists as well.
Wow, that's really amazing. So you've really kind of covered the gamut. You've not only gone, geriatrics for yourself, but also you've gone all the way down to the pediatrics piece of it as well.
It's true. And that is really interesting because there are not many pediatric orthopedic physicians in the entire county. So one of our physicians just retired. And so we have another pediatric orthopedic surgeon, and then we brought another one in. So we have 2. And they do a lot of work for the pediatric cases in Palm Beach County. But I forgot, I left out. Very, very important.
Okay.
We have 3 orthopedic upper extremity and hand surgeons in the group, too.
Wow.
You would be surprised how many people have orthopedic upper extremity, shoulder, elbow, and hand injuries that really need attention. And we have 3 of the best in the county.
Oh, that's fascinating.
Yes.
Fascinating. Well, tell our audience again, and listeners, please, if you have any questions, please give us a call, 888-565-1470. Give us a call, and we would love to answer your questions, whatever they may be, concerning your orthopedics, whether it is, foot, ankle, whether it's surgical, non-surgical, and also the acupuncture piece of it as well. So please also give them your information.
Sure. Orthopedic Center of Palm Beach County's main number is 561-967-6500. And our website is ocpbc.com. And just log on to the website and we'll give you all our office locations and our contact information, and also biographic sketches on each physician and information about what each one of us does.
Oh, that's great. That's great. You were talking about the acupuncture, and have you had acupuncture yourself to help with any kind of pains or whatever that you might have had? Have you experienced it?
I have experienced it.
Okay.
I'm a believer in it. I do some acupuncture on myself. It's hhard to do.
I would say.
It's hard to do, but I have.
Okay.
And I'm a big believer. When we were doing our training for the program that I got certified in, we had to do acupuncture on each other.
Okay.
So we did that also.
Well, I remember that probably, 10 years ago or whatever, I ended up tearing off one of the bones in my foot. And I had gone in and they had to do surgery and they put a pin in it. My ligaments were so strong that it just tore off the back of the bone. So I went in, I had this surgery, I had a cast on for like 10 weeks, and I come out, and my girlfriend, she's bugging me. She says, okay, you got to go to this acupuncturist. You have to go. And I'm like, Oh, right. All right. So I'm on day 4 on crutches, and she gave me name, telephone number. I went in, 3 needles, 20 minutes, and the doctor said, walk to me. And I looked and I said, I haven't been on this foot in 10 weeks. Are you kidding me? Walk to me. I've got to tell you, I walked on that foot for 45 minutes without any pain at all, without any crutches. I walked in hobbling with my crutches. I walked out with my crutches in my arm. And I've got to tell you, I was shocked. So I did the acupuncture, and then I went back the next week and I had another session done. So it went from 45 minutes the very first time, and then during the week, I was able to put more and more weight on it. I go back in for my second treatment, able to stand on it for 3 to 4 hours, started physical therapy. And I'm telling everybody, oh, you have to do this acupuncture. It's absolutely amazing. I really have no pain. I've been able to walk on it. I mean, I still had the little cast boot on. So I go to my podiatrist at week 3, and I come walking in, and he looks at me and he says, where's your crutches? And I said, I haven't had crutches for, a week and a half. If you hurt that foot and we got to go back in and do surgery again. And I'm like, oh my goodness. Wait until I take x-rays. So I go in and he takes the x-rays, and he looks at him, and he's looking at him, and he's looking at him. Wear regular shoes. Was the last thing I've ever heard out of his mouth. So I have got to tell you, I am a huge believer, not only acupuncture for humans, but also for dogs. I had both of my dogs go in for acupuncture as well. So I'm a total believer. And I'm so thrilled that you have brought those 2 modalities together in order to really, relax on the pill taking, because, the side effects of the pills, it can be really, really devastating. But also, though, to enhance, their life and know that they don't need to live with pain, and that the acupuncture is a great way, a holistic way of being able to deal with that pain.
Yes, I agree with all that. I think that you can tell somebody that it's virtually non-invasive. Of course, it's invasive because you're inserting needles, but the needles only go under the skin just a little bit, and most people don't feel it at all.
Right.
And if they do feel it, it's a sensation that goes away.
It's like a mosquito bite.
Right. And if you can offer patients an alternative and not affect their organ systems with drugs and medications, and protect them and yourself with a lot of the things that are going on with drug abuse and drug diversion, it really becomes a better alternative.
Yes.
And you can combine it with therapy and stretching and all the other modalities that you want to do. And that's what I do.
I love that. That's fabulous. And what makes that really, really, even more important is that sometimes our senior population, they're on so many drugs already, and then you go and you add more drugs to it to try to relieve more pain. And a lot of times it's so difficult for them just to be on schedule with their pill taking. So, anytime you can get off pills, and especially even the side effects and everything from pills. Now, I do understand that there are circumstances and times where the medication is necessary, but I'm all for the alternative. And I want to commend you for that. That's excellent.
Thank you.
That's excellent. Well, it has been an absolute pleasure to have you here. Again, if you have any questions, please give us a call at 888-565-1470. We would love to hear from you. And even if Doctor isn't here right now, we can still take your calls and pass them on to you.
Sure.
So just in case, you haven't gotten to the phone, or you're busy eating or something of that nature, you can still give us a call, and we'll make sure that he gets any of the questions that might be coming through from you. So thank you again. It is absolute pleasure to have you. Thank you for educating our audience and letting them know that there is an alternative, that it just doesn't have to be one way, that there are many different modalities that you end up being able to provide for them. So we're going to break for a commercial. Don't go away. Make sure you come on back. It's a short commercial. And stay tuned, because we've got another great guest coming on. So we'll see you in a little bit.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096.
Hi, I'm Deanna Barron, RN, with All County Healthcare. You know how I know that I've done a good job? We say goodbye. After you understand the medications you take, once you know that gaining 2 pounds in a day means you should call the doctor, when your wound is healed, when you can use your nebulizer all by yourself, when the goals that you and your All County Healthcare team of nurses, therapists, and aides established are met. We say goodbye. Very nice to meet you, and I hope I never see you again. And I mean that in the nicest way possible.
You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Hi, welcome back to You and Your Doctor, Living a Longer and Healthier Life. It's being presented by AMP2 TV and also proudly sponsored by All County Healthcare, where patients are the heart of their business. And I have to tell you, if sincerity, compassion, care, and patience is something that you need for yourself or for a loved one, especially after they're coming out of the hospital, going in for rehab, or if you just need somebody for daily care within the house, please give All County Healthcare a call. And welcome to our Facebook friends, by the way. It is wonderful to have you here. And if you at all have any questions for All County Healthcare, you can call them at 888-717-7170. Ask for Maddie. She would love to answer any of your questions. I've got to tell you, she knows it inside and out. So please give her a call. Well, without any further ado, I want to invite you to our next guest. This gentleman happens to be one of the experts in the industry, and you'll find out why. And he's also taken out his time and his energy to be here with us to help us learn and become educated about our healthcare, and also to inform us what we need to look for in our healthcare and in our physical being as well, because he happens to be a cardiologist. So welcome, Dr. Mitchell Carl. It's wonderful to have you here.
It's nice to be here.
Thank you. And thank you for taking out, this time to help educate and inform us. It's really very, very important, especially, heart conditions. I mean, that's a serious element. I mean, if that little ticker isn't working, guess what? We got problems.
Probably that's true.
Yes. So welcome. Give me a little bit of your background. Where you've been, where you grew up, and what made you decide to go into medicine.
Well, I'm from New York.
Okay.
I guess the sandy capital of the world. Probably an inopportune joke, considering that there's a hurricane on its way here.
I've got to tell you. Yeah. I know.
But I went to Emory undergraduate in Atlanta, Georgia. I wanted to sort of get out of town for a few years. And then I came back, actually, and went to Downstate Medical, which is in Brooklyn, New York.
Oh, wow. Okay.
And then after that, I did my internship residency and cardiology fellowship at Albert Einstein Montefiore in the Bronx.
My goodness.
And that was finished in 1990. And then I moved down here, and I've been in private practice down here since 1990. I was in solo practice for about the last 20 years of that, and then I had joined briefly a group, and then starting this February, I was given the opportunity and decided to go on my own again.
Oh.
And now I have a concierge practice, and I do internal medicine and cardiology.
Very interesting.
yeah.
Well, tell me a little bit about the concierge practice that you do. I don't think I've heard of the term before, so please share with
Well,
us.
concierge practices are getting bigger in certain areas. In New York, it's very big, in Arizona, California, and also in certain areas of Florida. The concept basically is that rather than seeing many, many patients and not having the time to focus on whatever their illnesses are, their questions, and things like that, instead we limit our practice to perhaps 1/10 of that number. But we really devote all of our time to those patients and making sure that they not only understand their illness, they understand the recommendations for continued health. And, most of the people that do join up, it's like, in a way, sort of like a club. Most of them that join up, once they get over the initial hurdle of deciding to spend the extra money, which is a hurdle, especially in these days. But once they do that, I think most people are very satisfied with the concept, and particularly, with my office in general. Yeah.
Wow. Well, okay, so I got that. That's a very interesting. Where is your practice located, by the way?
I'm in Boca Raton, about a block and a half from Boca Regional Hospital.
Oh, okay. All right. Well, why don't you tell the audience how to get a hold of you?
Well, I can be reached. Once you become a concierge patient, then you would have both my cell phone and the cell phone number of my nurse physician extender, and then you could reach us 24/7, 7 days a week. But the office number is 561-392-9214. And that's, I guess, how to best reach us. I'm in the 880 building, 880 Northwest 13th Street, Suite 1B. That's the Galen Medical Building. It's a big, beautiful building with these circular windows. Looks very nautical.
Oh, great.
Yeah.
Right. Well, that fits for South Florida.
Yes, it does.
Oh, well, that's wonderful. So you were talking about the concierge service and how it might be a little bit more expensive than, going to see a different type of healthcare provider.
Right.
Can you explain a little bit? It almost sounded, and correct me if I'm wrong, it almost sounded as if it was like a membership.
Yeah, it really is. It's very similar,
okay.
To a club, and the fee is really the access, and we still do bill insurance companies, for
Okay.
major work. We don't really balance bill just for convenience sake. People don't like to sort of keep getting bills. So for little things like office visits, if the insurance doesn't pay the whole office visit, we don't go back and charge the patient, for the remainder of the balance. So it really is just it's a once a year fee that the patients pay in order to be part of the membership, and then it's really our responsibility to take care of them, and we really treat them, like family. So it really is, we one of my patients recently, unfortunately, had a death in the family, and. We call, even though it wasn't a cardiac or even a medical issue to call her, both myself and my nurse did call her just to make sure that she was okay. And we spoke to the family because they were concerned about whether even receiving the news, whether she would be able to without having a significant heart problem as a result of it.
Oh, yeah.
So, we really, go the extra mile. If people are on a cruise ship, let's say, and it's 3 a.m. and they wind up in the ship's hospital, they can still reach us. The ship's doctor can reach us. If they're out of town, they can still reach us. If they get ill in their home and they're snowbirds and they're in New York or whatever, they can always pick up the phone and get us 24 hours a day, 7 days a week.
That's absolutely incredible.
Yeah.
Oh, my goodness.
Yeah.
You're always on call?
Yeah. Well, I also have, other sort of hobbies in medicine. So I'm actually a professor at the medical school at FAU. I'm an associate professor there.
Okay.
And I also am the director of the cardiology subspecialty rotation for the interns and the residents at Boca Regional Hospital. So that's sort of like a half-time career. And the other half-time, I try to keep a small concierge practice that's not, too big for me to manage.
Mm-hmm. Well, that's really, really unique. I love the fact that there's such a connection that you create, a relationship that you create with your clients or your patients, excuse me, and how important that is, especially, as you start aging. There's a lot of things that you've never had to deal with in your younger years. So it's so nice to know that there is someone out there that can take the time, that doesn't rush you, that explains things to you and helps educate you so that you can understand what's happening.
I think education should be and is a very important part of medicine. I mean, some doctors really don't take the time to make sure that patients are comfortable with the plan and understand the alternatives and what the risks are of doing it one way versus another way. They're just, very dogmatic, and they lead them like sheep. And I've never really done that. And people that come into my office that are interns and residents and they get to see me interact with the patients, they're really shocked because, most of the women, particularly, they don't want to leave until they get their hug. So there's really, it really is not, it really is truly, a sort of a family type of an atmosphere.
I love that.
My dad actually was very big in that. He was a physician in Long Beach. And interestingly enough, in those days, even a general practitioner used to deliver babies. So when I came down here, I actually found there were a couple of other physicians in town that were a little older than I was that were born in Long Beach in New York, and my dad had delivered them.
Oh my God, you're kidding.
No, and the important point that I was going to make is that one of the things he did well was that in those days when you delivered a baby and a woman was in labor, you would actually go to their house and stay with them sometimes for an entire weekend until they gave birth.
Wow.
So you essentially became part of the family.
Yes.
And I've always looked to sort of genuinely emulate that. I mean, obviously, there's much more technology in medicine now, so you can't really, all the time go with your medical bag to a patient's home. But we do that too. So if a patient really is bed bound and they're, they really can't get out of the house, we make house calls.
Wow. Yeah, that is very unusual.
Right.
But something, the other thing too, though, is a lot of the doctors, they're almost mandated to have a patient in within 10 minutes and out.
Right.
So they don't, they're not given that opportunity of really being able to create and form that relationship. Or, they only see them once a year, in and out, and it makes it kind of difficult, of course.
Well,
but
that's also a barrier for some people to doing this because the people that are healthy, they perceive themselves as not necessarily having a need for it, but until they do. So, a lot of those people I might see, let's say 2 or 3 times a year, but you really have to look at concierge as almost an insurance policy. So this way, you hope that you don't need it, but you know that if you do, it's there for you.
Yeah.
And, I can say honestly that the people that have done this and have signed up, and with us, they're very, very happy. They really didn't know whether they'd be happy when they first started it, but they're happy now. So I think that it is a good thing for us, and it's certainly a good thing for them as well.
Well, something, I really like that. And it almost sounds like it's the wave of the future as well. Because you do need a particular kind of bedside manner, I call it. Something that's warm and caring and compassionate and willing to listen. Because a lot of times, for our senior citizens, they don't have that down here.
Right.
They might have come down to retire and their kids are up north or they're living their own lives. So, it's so important to have somebody such as yourself to be able to relate to be able to talk to, and especially the way that you had said that you went out of your way to make sure that one of your patients, that she was doing okay because there had been a death in the family.
Right.
I mean, that for me is utmost.
Yeah, we actually even call patients just when they're lonely, So, we sort of have a little list of people that really are on their own and stuff like that. So we call them just to, check in with them and make sure that they're okay. And they really appreciate that.
I love that. Yeah. I mean, who doesn't appreciate a call, a check-in? Hey, you all right? You hanging in there?
When I honestly, before I went concierge, I never had the time to do that. I mean, you really would just follow up on things that had to be followed up on. You would sort of lay people out on the right path, and you would hope that if anything changed and they got worse, that they would call you. But that was always a very insecure feeling also, because some people didn't call you and they might have gotten worse, and you're sort of counting upon them to know if things are better and worse. But now, I find that since I've done the concierge, I just feel much better about the quality of the care that we're able to provide, that we don't have to wait for them to call us. We can call them.
I love that.
And so it really is nice. It is a nice feeling.
And if that happens to be important to you, I suggest that you give us a call, 888-565-1470, and talk to Dr. Carl and get some more information from him. Because I know that for any of our audience members, how important it is to be able to find somebody who can listen, who can teach, and who understands us and creates that relationship. So please give him your telephone number again.
Okay, well, it's 561-392-9214.
Excellent, excellent. And I also like to say thank you to All County Healthcare for providing the show this evening. You can find us here on Tuesdays from 6 to 7. We are streaming live. No, this is not recorded. So the mistakes are real. No, right. I'm teasing. And the other thing, too, for the doctors out there that are listening, if you'd like to be on our show, please give us a call as well. Call in 888-565-1470, and we would love to find out more about you and your practice and have you on the show possibly as well. So, you know something, I love that you have, it must have been awful risky to move away from what the known was to create this concierge. I mean, part of me says, are you open to new patients? Can you take new patients in?
Yeah, well, we've actually, many concierge practices have a limit. Not everyone is strict in terms of following that limit because they realize that as a business that if they take more patients, they make more money. We really have decided that we are going to be very true to our patients and to our word, and we're limiting our practice to 200 patients, which is considerably less than most concierge practices. And I'm really the only one that I know of that does concierge, both internal medicine and cardiology. So we actually do both.
Wow.
And and we have about 160 patients now. So we're just looking for
okay. We've got 40 more.
The right
so
40 more.
Yeah. Call in.
Call
in and grab it fast. Absolutely. So tell us a little bit about cardiology, about that particular specialty that you do. What are you finding out there? Is there anything new that's coming up? Any more of the state of the art information technology that you're seeing, that you're using?
Well, I wouldn't say that it's brand new, but one of the sort of newer things that I could sort of speak about that I think is really important for those that are listening is that, we go by a lot of different metrics of lab work to decide whether someone is at significant risk for having blockages in their coronary arteries. And that whole process is really very imperfect. So essentially what winds up happening is that there's a whole bunch of risk factors on sort of one side that you can visualize on the tennis court that sort of says that they probably have disease, and then there's probably an equal amount on the other side that maybe suggests that they don't. And so at the end, we're left with all these algorithms to determine what the likelihood is of them having disease and the likelihood that they would benefit from what we would do to treat them for it or work them up for it. And really, because that is so imprecise, there's another sort of game in town, which I think is much better, and that is something called CT scoring, which basically is a CAT scan that you really does not give a lot of radiation. It's a low-energy CAT scan, and it's done usually within 30 or 40 seconds. No injections go into the patient, so it's non-invasive. And really, again, has much less radioactivity now than it used to have because the CT scanners are so fast now, and therefore they use so much less energy in being able to acquire their images. And from that, you're able to see how much calcium is bound to the coronary arteries.
Really?
And because cholesterol is negatively charged, when that sits in a coronary artery, it has to be neutral by binding to calcium. So you can get a rough approximation of how much coronary disease somebody has by looking at their calcium score. So really, the idea of just going by lab work or other risk factors to determine whether or not someone likely has disease can now be replaced by something much more dogmatic. Do they have disease? And if they have disease and we find that they have enough plaque that we're worried about them, then we can do further studies like a stress test or an angiogram or something called a CT angiogram, which might is another type of CAT scan where we we provide dye, and we can actually see the vessels in 3 dimensions and see whether there's blockage. So, but in those patients that we don't see blockage, and furthermore on the CT score where they have a score of 0, meaning that they have no calcified plaque, we know that prognostically they're in very good shape.
Okay.
And they don't need to be on medications like statins, and they don't need to be on aspirin. They don't need to be on, getting all these expensive and scary tests done.
Mm-hmm.
So it's really a way to give people more assurance that they're not getting anything more than they need on the one hand, and that they're not getting anything less than they need on the other hand.
And I love that too. I mean, when you can take all those tests and then specifically have one test, I mean, because I know, unfortunately, a lot of doctors, they send you out for, 10, 15 different tests. And that all costs money.
It all costs money,
Yeah.
and it all makes people very nervous.
Yes, and
then
scared.
and sometimes you wind up with conflicting data, with one test that suggests that you should do something, and another test that suggests that you don't have to do something. And what does that lead to? It leads to a third test.
Oh, yes,
because now you have to split and decide which one of them is right. So, I think that there is certainly, an argument to be made to sort of simplify these things and have more absolute data so that people don't have to run around getting a lot of tests that they don't need, and they can be more sure that they're on the right track.
Yeah, and something, the other thing too is that I love the concierge service concept, the membership concept, because you have created this relationship, number one, with them. Number two, you're not going to take them down the pike just to make more money. Because it doesn't make any sense then. And not only that, what you do
I would never take them down that pike anyway, but you're right.
Yeah. And the other thing too is that, you create a trust.
Right.
And that's what they're looking for. They're looking for somebody that they can trust.
Right, I agree.
And somebody that's reliable and dependable. And I got to tell you, 24/7.
Right. Well, there really shouldn't be any shortcuts in medicine. You really should, the people that and I don't think there are many. I think that, Florida sometimes gets a undeserved bad rap. I can tell you honestly that, that many of the doctors, or most that I know at Boca Regional, are very, very dedicated physicians that care only about doing the best for their patients. They don't. The idea of testing to make money doesn't even cross their mind for the vast majority.
I love that.
But I do agree with you. I think it takes away a lot of the preconceptions that people may have that there are, testing for other reasons other than to their benefit. Because really, once they've signed up and they've joined a concierge practice, the doctor has, every interest in making them and keeping them as well as possible. So there's, their finances are no longer dependent upon, procedures that they do, even if they're necessary.
Yeah.
Instead they're getting, paid reasonably. And the other thing is, it creates a really unusual bond that's very real. So when I went and did this, and you said it was a big risk, indeed it was.
Yeah, that's what I was thinking.
And I had a practice of somewhere between 1,500 and 2,000 patients before I did this.
Oh my goodness! You're right. You didn't have any time and energy.
And if you do the math, you would know that about 1 in 10, stayed. And initially, it was scary, and it was a little bit depressing, because I had thought that those relationships were more solid, and that for what I don't consider a huge amount of money, that those patients would want to keep that relationship. But a lot of them would, really didn't see it and wanted to go next door where it was free. And that was, that was a little bit hurtful, I have to be honest. But those that did decide to join, those 160 patients, it's very, very affirming. It really makes you feel very good about what you're doing. It makes you feel that, that here's, a patient that really is able to see that
the value,
that having you is worth extra money than what Medicare, might pay. And it makes you feel that you want to return it, to them, that you want them to feel like that you really do care what you do, and that they're getting their money's worth. And so I'm very happy with the whole concierge, concept, at least, for me. And I think that we've made it, a very good thing for our patients as well.
It must be very rewarding.
It is.
And I was laughing because does it make it difficult sometimes where you go out to dinner and then all of a sudden you see your patients out there and they want to come and sit down and talk and,
Well, let me answer that question by saying this. The first time my phone has been off in the last week or so was during this interview.
Oh, really? Yeah. Oh, my goodness. Oh, well, I've got to tell you, I really do appreciate the fact that you've, given this time to us to help educate and inform and give us some insights, especially on what's new and happening in the cardiology world. Anything new in the internist world? Anything that you can think of?
Well,
Yeah.
in terms of preventative, let's just put it that way. In
Yes.
terms of preventative care, people are very knowledgeable about the fact that as their cholesterol goes up, they're at greater risk for heart attacks and strokes. In the past, that always meant statins to people, which are things like Mevacor and Zocor and Lipitor and Crestor. But there's a very large perception of intolerance over time. Some people have
Right.
muscle aches, muscle weakness. So there was really a need for sort of a new drug out there, and there is one.
Oh.
There's a new class of drugs which are actually monoclonal antibodies. So they're really antibody-type drugs that bind directly to an enzyme called the PCSK9 receptor. So
Okay.
I won't ask you about that at
Yeah,
the end of the
okay.
interview. But suffice it to say that receptor is responsible for breaking down the things that break down cholesterol. And so if we block that thing that breaks down the receptors that break down the cholesterol, if we block the things that break down the receptor that breaks down the cholesterol, then that receptor is able to pull more of the cholesterol out of the bloodstream.
Oh.
And what's been found is these molecules are extremely effective, and they lower people's bad cholesterol to probably less than half of whatever it was. Even people with normal cholesterols are walking around with bad cholesterols that are barely measurable, like 30 and things like that.
Oh, my goodness.
And what we don't know yet is whether or not that's going to translate into the same sort of benefits in terms of decreasing heart attack risk and stroke risk that people do get that benefit of those that can tolerate statins, but not everyone can. So that's really among the newer things that are out there that may turn out to be a very big benefit to people that have cholesterol and don't tolerate statins.
Well, that's really, really interesting. Now, if you bring down the bad cholesterol, does it necessarily mean that the good cholesterol comes up, or how do you bring your good cholesterol up?
That's a very good question. A better question is really whether you should bring your good cholesterol up. So what's clear by certain long-term longitudinal follow-up studies where we have people, we don't intervene, but we know what their good cholesterol is, and we just see whether they do well over time, that people do well over time. So the better your HDL, which is the good cholesterol, the more likely you are to have a full life without having a heart attack or a stroke. What's not as clear is that when we manipulate the HDL by giving certain medications and we make it artificially go higher, there's not a lot of data that we're actually benefiting the patient. So those patients actually, in some studies, have a higher chance of having problems than if they weren't on those medications.
Wow.
So
That's really interesting.
So I think if you want to get your HDL up, and clearly there's data that the higher the better, but I think probably better in natural ways than not. So alcohol in moderation tends to raise your HDL. Exercise helps to raise your HDL. HDL and triglycerides tend to be reciprocal. So things that, fatty foods and things that you might avoid that might lower your triglycerides will have a tendency to reciprocally raise your HDL. But I think it's not only that there's a specific number that's optimum, it's how you get there.
That's fabulous. Thank you so much. That was really informative.
It's my pleasure.
I am so glad that you're here and giving us all this information, because that's really, really important. So I thank you again for being on the show, you and your doctor, living a longer and healthier life, and also your concierge service, and what a benefit that is to the members that you have. And he only has 40 openings left, so please make sure you give him a call. Listen, I'd just like to thank you again for joining us this evening on You and Your Doctor, Living a Longer and Healthier Life, being presented by AMP2 TV and proudly sponsored by All County Healthcare, where patience is the heart of their business. Please join us again next Tuesday between the hours of 6 and 7 here to learn more about the doctors, your health care, and what you need to do in order to make sure that you have the good choices that are available to you. So thanks again for being with us. Have a great evening.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life. The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.